This is News 4 Nashville.
And thanks for joining us. Nashville set a record today for the number of people who have tested positive for COVID-19, 688. And today, we learned of 8 new deaths. A doctor who works on the front lines with COVID patients describes what it's like to deal with the sickest patients, patients who may have lingering effects. Here's News 4's Nancy Amons.
Imagine the things that doctors see every day. Listen to Dr. Brett Campbell. He's an anesthesiologist at Ascension St. Thomas West. He deals with the sickest of the sick.
Severe ICU courses of coronavirus can typically last weeks, sometimes months.
The patients are often on breathing machines, feeding tubes, catheters. They may have kidney malfunctions and need dialysis.
Patients often develop delirium in the ICU, which can be extremely difficult not just for them, but for their families. Despite all these interventions, some of the patients don't survive. For those that do survive, the road to recovery is long and often can be very challenging.
Like permanent lung damage and PTSD. Nashville's sickest patients have come in the last few weeks, he says. They are across the age spectrum, but the majority are people in their 50s and 60s.
You may not be in that age range, but I would bet that you know somebody who is.
Infections are rising in all age groups, but 3 out of 10 infected since June 15th are between 25 and 34. Many infections linked to bars and parties.
Stopping the spread of the disease from the young to an older cohort, which in many cases can be fatal, has to be a priority.
We have to go back to what we were doing a couple of months ago.
Masks and social distancing. I asked if the city is considering rolling back to phase 1.
All options are on the table.
Metro health officials want to watch the numbers over the next few days and see what impact the mask mandate and phase 2 rollback is having.
Metro reported 688 new cases today, but some of those were from a lag time in the lab. They were cases reported from last June, 172 of them. That's one reason the city has changed labs. Nancy Amons, News 4 Nashville.